Did you know that COVID-19 can affect your heart? In this video, I'll talk about the latest research on how COVID-19 can cause heart problems, including myocarditis, pericarditis, and heart failure. I'll also share some tips for protecting your heart health after COVID-19. Understanding the impact of COVID-19 on cardiovascular health. The global COVID-19 pandemic has left an indelible mark on our lives, reshaping the way we work, interact, and, most importantly, how we prioritize our health. While the full extent of COVID-19's impact on our well-being may take years to comprehend fully, one thing is clear. For many individuals, the symptoms are intense and can persist for months, if not years, after the initial infection. This article delves into a critical aspect of COVID-19's repercussions, its effect on the cardiovascular system. COVID-19, caused by the novel coronavirus, can manifest in various ways, affecting individuals differently. What remains unclear is precisely how the virus impacts the heart. Several theories attempt to elucidate this phenomenon, with some experts pointing to increased inflammation of the heart and arteries as a potential cause. Low oxygen levels may also play a role in these cardiac complications. Despite the enigmatic nature of COVID-19's impact on the heart, it is evident that such consequences are not uncommon. In this article, we aim to explore the intricate relationship between COVID-19 and cardiovascular health, shedding light on the potential risks and offering insights on how to protect oneself. It is essential to note that not everyone who contracts COVID-19 experiences heart-related issues. For most individuals with mild disease and those who were previously healthy, the risk of severe cardiovascular complications is relatively low. However, the risk escalates significantly for those with severe COVID-19 cases, particularly those requiring hospitalization or intubation. Additionally, certain demographic groups face a higher risk of heart-related complications. Older individuals, immunosuppressed individuals, those with pre-existing cardiovascular diseases, and individuals with comorbidities such as high blood pressure, obesity, and diabetes are particularly vulnerable. In the subsequent sections, we will delve into the range of cardiovascular problems that can emerge in the wake of a COVID-19 infection. COVID-19 can lead to a spectrum of cardiovascular issues, ranging from mild to severe. Some of the most prevalent complications include myocarditis, the inflammation of the heart muscle, or pericarditis, inflammation around the heart, can occur as a result of COVID-19. While this may sound alarming, it's crucial to understand that myocarditis often resolves without long-term complications. In severe cases, it can lead to heart failure, a condition where the heart cannot pump effectively. However, such severe cases are relatively rare. Arrhythmias and irregular heartbeats can manifest in individuals with severe COVID-19 infections. In some cases, these arrhythmias can be associated with myocarditis, exacerbating the heart's ability to pump blood effectively. Untreated, these arrhythmias can be life-threatening. POTS is a syndrome characterized by dizziness, increased heart rate, and fatigue when transitioning from a lying position to standing. POTS is more common in women and can linger for extended periods in some cases. Research led by Dr. Gulati and her team at Cedars-Sinai found that individuals with COVID-19 who experience a heart attack during their infection face a higher risk of mortality. These patients are also more likely to require ventilator support and hemodialysis. The precise relationship between COVID-19 and heart attacks remains an area of active investigation. COVID-19 does not directly infect the heart muscle. Instead, it triggers a cascade of events that can lead to heart damage. The virus induces widespread inflammation throughout the body, which, in turn, can harm the heart and other organs. Individuals with pre-existing cardiovascular diseases are particularly susceptible to these inflammatory effects. COVID-19's ability to cause heart damage is closely tied to inflammation. When the virus infects the body, it prompts the immune system to produce inflammatory cells and cytokines. While this is a natural response, COVID-19 can sometimes lead to excessive inflammation, known as a cytokine storm. This can disrupt the heart's electrical signals, potentially exacerbating existing arrhythmias. Moreover, inflammation can lead to the formation of blood clots, which can increase the risk of heart attacks and strokes. Inflammation can also cause myocarditis and pericarditis, conditions that can result in chest pain and fluid accumulation around the heart. Individuals with cardiovascular disease or risk factors are at the greatest risk of heart damage due to COVID-19. This includes those with heart failure, coronary artery disease, diabetes, obesity, hypertension, and a history of stroke. These pre-existing conditions make individuals more susceptible to severe complications from COVID-19, including heart-related issues. COVID-19 of May heightened the risk of heart attacks and strokes, particularly among hospitalized patients. The underlying factor here is inflammation, which increases the likelihood of blood clot formation and reduces the body's ability to naturally dissolve clots. As a result, vital organs, including the heart, can be deprived of oxygen, leading to heart attacks. Amid the COVID-19 pandemic, many individuals postponed or avoided medical appointments and emergency care due to fears of infection. However, it is essential to prioritize your health. If you experience symptoms of a heart attack, seek immediate medical attention by calling 911. Timely care is crucial in preventing further heart damage. Even after recovering from COVID-19, some individuals may continue to experience heart-related problems. The risk is higher for those who require ICU care or mechanical ventilation. However, even individuals with mild or asymptomatic cases may develop heart issues later on. If you have had COVID-19 and experience symptoms such as chest pain, heart palpitations, a fast heart rate, dizziness, or shortness of breath, it is essential to consult your healthcare provider promptly. Tests such as electrocardiograms, EKGs, or echocardiograms may be necessary to assess your heart's function. COVID-19's impact extends beyond the heart, affecting various organs and systems, including the lungs, brain, and kidneys. The virus attaches to ACE2 enzymes in the body, which are present in the heart, lungs, and blood vessels. This widespread distribution of ACE2 receptors allows the virus to damage multiple organs. To protect yourself and others from COVID-19's potential heart-related complications, getting vaccinated is crucial. Additionally, wearing a well-fitted mask in public places, staying home when unwell, and practicing frequent hand washing can reduce the risk of infection.